Let's move on to the second error correction procedure you may be instructed to use in the later stages of learning, least to effective prompts. You will use this error correction when you are unsure if the child really knows the correct response. For example, a child may have a history of inconsistent responding or a known difficulty with a particular target. In situations such as this, it would be ineffective to use the no-no prompt repeat procedure we just discussed, because if you anticipate that the child will respond incorrectly twice, it would not be constructive to repeat the SD without a prompt. In this case, your supervisor may have you use the least to effective prompts error correction procedure instead. This strategy is called least to effective because after giving one no, you prompt on the next trial using the least intrusive prompt. If the child still does not respond correctly, then on the third trial, you use the last effective prompt to ensure a correct response. On the fourth trial, you would repeat the SD without a prompt to allow the child to respond independently. Let's look at a similar example of sitting to the SD sit down, but this time with a different child, Johnny. Johnny has been working on this skill for a while and has been inconsistent in his ability to respond to the target SD sit down. Therefore, his program supervisor has instructed the therapist to use the least to effective prompts error correction procedure if Johnny does not respond within 3 seconds of this SD or responds incorrectly. During Johnny's therapy session, the therapist presents the SD sit down. Johnny does not respond within 3 seconds, so the therapist presents an informational no. Then the therapist presents the SD sit down a second time with the least intrusive prompt, a gesture towards the chair. Again, Johnny responds incorrectly, and the therapist gives another short, clear, informational no. The therapist then presents the SD a third time with the last effective prompt, a physical guidance towards the chair. Johnny responds correctly, and the therapist provides social praise, a mild reinforcer. Finally, the therapist helps Johnny to stand up and then repeats the SD a fourth time, giving Johnny an opportunity to respond correctly with no prompt. Johnny does, and the therapist provides the stronger reinforcer of praise and a few seconds of play with one of his favorite toys. Although not shown in this example, many children respond correctly to the least intrusive prompt when this procedure is used. If the child responds correctly when the target SD is presented with the least intrusive prompt, the therapist would then repeat the target SD without a prompt, allowing the child to respond independently. In most cases, the prompt used to teach a new skill or correct an error is very effective in evoking a correct response from the child. However, there are times that a prompt may not evoke the target response. So what do you do when you are teaching a new skill or correcting an error using a prompt and it doesn't work? If the prompt that you are using in a particular trial does not evoke the target response from the child, you would end the trial with an informational no, then repeat the SD with a stronger prompt, a prompt that is highly likely to evoke the correct response, such as a full physical prompt for a nonverbal response or a full echoic prompt for a verbal response. Let's look at an example of how this is done. Aaron is learning to respond to the instruction, clap your hands. The therapist presents the target SD, clap your hands, and prompts using a model prompt, clapping her own hands. Aaron does not respond, meaning the prompt was not effective. So the therapist provides an informational no. The therapist then repeats the SD, clap your hands, and picks up Aaron's hands and physically prompts him to clap, a stronger prompt that is very likely to result in the correct response. There are 2 general guidelines to keep in mind when using prompts to teach new skills or to correct errors. The first is to use the least intrusive prompt possible. For example, if just touching a child's hands is an effective prompt for the child to clap his hands, the therapist should not provide a full physical prompt. The second guideline is to avoid giving inadvertent prompts. An inadvertent prompt is unintentional behavior on your part that evokes the target response. For example, When teaching a child to receptively identify objects, the therapist asks the child to touch the car, not realizing that she is looking directly at the car in the field of 5 objects. The child follows the therapist's line of sight and touches the car. This is an inadvertent prompt because the therapist did not intend to use eye gaze as a prompt. It is important that you keep these 2 guidelines in mind as you apply the skill-building techniques you learned in this lesson. The use of effective prompts and prompt fading procedures is critical to establishing appropriate stimulus control and the ultimate success of the child.